to be your loving self. This is KMET 1490 AM ABC News Radio Live. I'm Dr. Mitra Rashidian, and I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in Encino, California. And I'm offering this program along with my colleague, my best friend, and my business partner, Dr. Robert Jaffe, whom I have the pleasure of working with and associating with for the past more than a decade, I should say. If
going on two.
Not yet, but
well,
eventually.
Going on two. We got what, 17?
About 17.
Well, that's going on two.
Yes, right. So we have been, sharing this journey with you for the past year or so, having 2 hours of program, and this is our last program. Today was the last one that we had 2 shows together back to back, starting at 3 p.m. And starting next week, we're going to go with 1 hour. That means we're starting at 4 p.m. at the same time as you have it now. And we are hopeful and we're looking forward for all of you to join us, and also our family and friends of who joined us at 3 p.m. And without you, this program is not going to be possible. So we are requesting and we are looking forward to hearing from you. We want your stories. We want your participation. We want to learn from you, because we are no expert if you're not here. And you are the expert of your life. So you're teaching us, and we collaborate and we learn from each other. And that is our aim. So I'm glad that we have this opportunity to be here with you today. And then we are starting with Dr. Robert Jaffe, who's going to share with us about another aspect of codependency, trauma, addictions, all impacting relationships.
Thank you.
My pleasure.
What a nice introduction.
Thank you.
So our next show is going to be a combination of our 2 shows.
Right.
So we will be talking about sexuality and relationships, as well as trauma.
Yes.
And so today I thought we would talk a little more about where addictions come from. Many people have an idea that addictions are a disease. The disease concept of addiction has been pretty widely accepted, as though you can catch it, right? So if you're walking down the street and someone else has an addiction and they walk up and they go, "How you doing, Joe?" and they slap you on the shoulder, then you can catch it. Well, obviously you can't do that. So in that way, it's not a disease. So it actually is not a disease at all from my point of view. I've been studying it and working with addiction for many years. To me, it's something that is learned. There may be a biological component which allows some people to be more susceptible to addictions than other people. But usually addictions come out of emotional difficulties that people are looking to get resolved, and addictions serve the purpose of making the person feel better than they had been feeling prior to using the addiction. So, we hear a lot about alcoholism. We hear a lot about legal drug addiction, people, getting drugs from doctors. And then, of course, the black market is filled with all sorts of substances that you can use in order to change your feeling state and get high.
And I like to add that, when we're talking about addictions, and so this, it's not limited actually to just using drugs or consumption of alcohol. There are other ways that people choose to numb themselves and get away from their emotional difficulties, and sexual addictions, or actually now we call it sexual compulsivity, is another aspect of it.
Absolutely.
Right.
Yep.
So that's not using any substance, that's not drinking any alcohol. However, a person becomes engaged in a variety of activities that's related to sexuality, such as the use of porn, such as using, phone sex, such as using any other means of sexuality to get them into the state of high and also away from their emotional, discomfort, even if it is for an, moment of relief. And in my practice, I do have quite a few of them, and I have just to say that the impact of that on the family relationship is really sometimes irreversible.
Mm-hmm. Yeah, yeah. And so when you say sexual compulsivity, so there's still a debate going on as to whether that can be classified as an addiction.
Right.
But actually, what is addiction? Addiction is compulsivity. I have a compulsive need to have a drink. I have a compulsive need to take the pill that makes me feel better. I have a compulsive need to gamble. I have a compulsive need to have sex.
And also compulsive need to eat and overeat.
And yeah, right. And so we can say that those are compulsions. And at some point, if you have a lot of compulsivity in your life, then you can say I'm an eating compulsive, or I have an eating addiction. I don't really think it matters too much what word you use to describe it, because the reality is that your behavior is out of control.
Right.
And
yeah, I guess the label doesn't matter whether it's compulsivity or is it addiction. The point is, it's an out of control behavior.
It's an out of control behavior.
Hoping that it will relieve the pain of the individual.
And it does.
It does.
It does.
Yeah.
Right. If it didn't, then you wouldn't have millions and millions of people struggling with it.
Exactly.
Right. So obviously it works. However, there's an upside and a downside. The upside is pretty obvious, that it works to give you some temporary relief from the feeling state that you're in that you're not comfortable with. I'm so stressed. I just need a drink. I just feel like I'm bored. My days, every day I go to work, I come home, I have dinner, I watch TV, I go to sleep. I just got to go out and do something. I know I'm gonna go to Vegas and I'm gonna gamble, and that gives me that'll get me excited, and that'll get me feeling good.
Exactly.
So now, is there anything wrong with gambling in and of itself? No. Is there anything wrong with drinking alcohol in and of itself? No. There's nothing wrong with it. The issue is, to what extent do you do it, and is it interfering with your life in other ways?
Well, that when you talk about interfering with your life in other ways, this statement just reminded me of how, and I know that this is still, there are so much of a discussion about it, so nothing is confirmed. However, I hear from parents that their like toddlers or even 1-year-old, child, they are so attached to their iPad. I have actually a couple that they state that their child, who's almost 2 years old, he doesn't eat unless his iPad is right next to him. Right. So to me, when I hear that, I can see that how this child's brain is being used to becoming overstimulated in order to stay intact and functionable. Right. So to me, that can be the beginning of an addictive life.
It can be, yes. Yeah.
Right.
And we don't want to say that if you give your child an iPad or if you give your child a computer, that that's going to make them addicted.
Right. But at this level?
But, well, no. Again, addiction comes from wanting to change your feeling state.
Exactly.
And so that then begs the question of why do you need to change your feeling state? And usually we need to change our feeling state because our feeling state is not comfortable. What we want is to feel good, right? We want to feel comfortable. We want to feel happy. And and unless there's something physiological going on with you, where your brain is giving you too much of one chemical or another chemical, which happens, but not that frequently. I mean, it does happen, but unless that is happening, then on an everyday basis, because you're living life and life presents a lot of interests and challenges, you actually are doing okay if you going through life and feeling good about yourself and about your life. If you haven't, then you have to take a look at what have you done or how have you set up your life to not fulfill you.
Right.
That's one thing. The second thing is, what if you have a lot of stressors in your life? And the things that are the most stressful in our life are traumas, right? Now, you and I have just recently, read about within the last couple of years, about trauma being actually two different kinds of traumas.
Right. Well, the study was introduced about less than a decade ago.
Less than a decade,
right.
Yeah.
Yes.
Right. Which is fairly recent
right.
in terms of our learning curve. And the two ways of being traumatized are what we would call, what's the word, high...
Hi, this is Matthew Stafford of your...
I'm sorry?
Small T trauma and large T trauma?
Yes, thank you.
Yeah.
Large T trauma and small T trauma.
Right.
Right. And so large T traumas are the traumas that everybody would agree are traumatizing, which would be any kind of natural disaster, fires, earthquakes, hurricanes, floods,
loss of job, divorce,
loss of job, divorce, death in the family, serious illness, those type of things are traumatic. And what do we mean when we say traumatic? What we mean is that your brain is flooded with a lot of chemicals that make you sad, that scare you, and that make it hard for you to feel good about your life. Those are the things that's what happens when you're traumatized. But what we've learned recently, and you say recently in the last 10 years or so, is that we don't actually need that level of trauma in order to disturb us emotionally. And that what we call small T traumas can be just as devastating and are actually even more widespread, more ubiquitous throughout the human lifespan.
Yeah, they are more devastating, actually more impactful, because actually they are pervasive, and we grow up with many of them.
We grow up with many of
and
them
without even recognizing it.
Without recognizing it.
Right.
Now, does that mean that because people have grown up and been traumatized with small T traumas, that they are going to then develop post-traumatic stress disorder, PTSD? Does it mean that they're going to then be affected so that they're looking for something to make them happy because they can't be happy because they have been traumatized with these small T traumas? And the answer to that is sometimes. Sometimes it does and sometimes it doesn't. because what really trauma depends upon is not just the traumatic event, but also how the individual responds to that traumatic event.
Right, exactly.
Yeah.
Right. And then that's the style that once a person connects to a style of surviving within a traumatic situation, it can stay as a form of, communication, as a form of defense, as a form of taking care of, themselves, in adulthood as well. I mean, we hear that some people say, when my boss tells me something, I just freeze. I can't even respond back,
Mm-hmm.
or when somebody says something to me, I get so angry, I just punch them back.
Uh-huh.
So these are good examples of fight or freeze responses during childhood trauma, for example.
Right. So it releases chemicals in your brain that come from the reptilian part of the brain, and that creates fight, flight, or freeze response,
Right.
which are survival mechanisms. Right. If you see a car bearing down on you and the car is going fast, and you freeze, you're probably going to get hit and die. But because because your brain is giving you these chemicals that make your muscles stronger and adrenaline starts flowing, you do have the ability to run away, right? And so you may be able to run more quickly across the street and not get hit by the car. So that's what happens when we're traumatized. We have these fight, flight, or freeze responses. Now, that's true depending upon our response to what's going on. So if you're looking at a television show, one of the television shows I like is called Criminal Minds, right? Criminal Minds is about people who are crazy and they go out and they commit killings. The Criminal Minds actually itself doesn't show the killings, but it may show a perpetrator with a bunch of victims and they're about to be killed. It doesn't actually show them shooting or hurting them, but it shows that they're in a very dangerous situation, these people. And then it flips back to, well, how do the people in the FBI or the CIA, how do they solve those crimes? So it's really a whodunit police type of thing. Now, for some people, watching that show is traumatizing.
Exactly.
And for many other people, it's not traumatizing. So it isn't the show itself that makes the person traumatized. It's their response to it.
Right. It's like when we see, a comic movie, we start laughing.
Exactly.
When we see a sad movie, we start crying automatically. When we see a very deep, affectionate love movie, when two lovers are getting separated from each other, our heart starts to ache and we cry too, right?
Yeah, but we're talking also in generalities,
right?
Right.
Right.
Because there may be a comedian out there who is telling jokes or acting out a comedy skit, and there's an audience, and there's 100 people in the audience, and 98 are laughing, and two are just sitting there like, what's the big deal?
Exactly.
Right? Right. Or it could be 50-50, or it could be...
They're not going to be invited the next time.
Could be 80-20, right? So we all have our own ability to make meanings of the things that are going on in our life. And so one person's trauma is another person's no big deal, right? And so there isn't, although we can say in general, the large T traumas are generally traumatic for most people, right?
Right.
But let's say if you are a child and you're growing up in an environment where there's your father gets a look on his face and he starts yelling, and you're a young child, there's a good chance that that's going to be traumatic for you. But how that trauma actually affects you and what it does to you in the long run, that we can't predict.
Exactly.
We don't know.
We don't know that. Yeah.
But what we do know is that a lot of people who struggle with addictions, and we're going to go back now to codependency. Codependency is actually its own addiction, and what we would say about codependency is that it's an addiction to getting relief from our feelings of fear or abandonment through the use of another person. So in codependent relationships, we use other people in order for us to feel okay.
And also to release our emotional negativity.
And also to release our emotional. Yeah, say a little more about that.
You know, we see that many couples come here, and then what they do, you know, they point at each other that, you know, her fault, his fault, you did it, she did it, he did it, your mother did it, your sister did it, your brother did it, you know. So that's, instead of looking at themselves and how they are relating to each other, they're borrowing collateral, you know, resources in order to release their discomfort, and they target each other.
Right.
Which what we call it is projection.
Projection. Right. Right. So I'm feeling uncomfortable inside, and you're standing next to me, and you have a certain look on your face, and because you have that look on your face, and I'm feeling uncomfortable, I'm telling myself that you shouldn't be looking at me the way you're looking at me.
That's a one good example. The other example is, for example, that the wife may tell, you know, her husband, why did you spend 2 hours at the gym when I want to go to do my nails, and, you know, you're not here?
Exactly. Right. Yeah. So once we identify that the other person is acting in a way that we don't like, then we move into, oh, I need to change their behavior so that they act in a way that I like, so that I can feel comfortable.
Yes.
Right?
Yes.
And there's probably a lot of people who are listening to us right now say, yeah, well, what's wrong with that? Obviously, you know, if I'm acting in a way that my husband or my wife doesn't like, and they tell me about it, I want to change it.
Or, you know, sometimes they say, have you seen them, what they say? Have you looked at them, how they behave? You know, you're taking their side now. You know, so we become part of the equation.
Exactly. Yeah. So this is a way of behaving, and then a reaction to how the other person is behaving. The question is, does our reaction to how the other person is behaving a done deal? Do we have to react in the way internally and externally that we are reacting to the way the other person is behaving?
Well, let's find out right after our commercial break, which is going to be, you know, just now, and then we see you back in a short few minutes.
Okay, please stay with us.
Commercial break. Dr. Mitra and Dr. Robert here at KMET 1490 AM ABC News Radio Live. We are, and you know, at our last show that we had a couple of hours, and starting next week, we are gonna have our first show starting at 4 p.m. So I'm really stumbling on many words, and my apology. I don't know what's happening, but I guess, you know, it has to do with our show. We don't want to do that, but we have to do it anyway. So let's not get into the details. So. So, okay, I would like to invite you to please call us, you know, 951-922-3532. And if you wish to have your conversation privately, you may email us or call us. We actually have an updated, you know, homepage information at KMET. So I'm inviting you to please go there and revisit our homepage and pick up the new information. It gives you more of a descriptions about what our upcoming show is going to be including. And we hope that the next programs are more appealing to you. We are looking actually to have some guest speakers, so we will announce that all of that when we have them in the early show on Thursdays at 8:40 a.m. So we have many new changes for you, and we hope that you will love and you will join us. Uh, and then these new changes, we hope that brings you more excitement and more connection between you and between us. So, Dr. Jaffe, you were talking about
Yes.
Codependency.
I was talking about codependent, and where we left off was we were talking about blame.
Right.
And we were talking about is it if I treat you in a certain way, is it a done deal that you have to respond in a certain way? That was the question that we left off with. And the answer is no, it is not a done deal that you have to respond the way that you do respond. We actually do have freedom of choice. And we can choose to respond the way that we intend to respond, or we can respond, or we can react rather than respond. What's the difference? So I use the analogy of being at the doctor's office, and he says, okay, now cross your knees, and he takes out that little tiny hammer and he touches your kneecap and your leg goes up, right? We call that a reaction, right? That is an automatic reaction because it's a reflex. He's touching the nerve in your kneecap, and the nerve is reacting.
Right.
So we don't have control over that because that's an automatic reaction from the nerve in our kneecap. But when we're dealing with other people, we often have things that remind us of other things, sometimes consciously, but many times subconsciously.
Yeah.
Right. So when you said the word, I'll make something up. Actually, I'll give you a great example because I just read about this example. So a husband and wife, they were in therapy. And they were talking, and the husband said to the therapist, "My wife is crazy," and the wife is sitting there, and the therapist says, "Oh, really? What do you mean?" And he says, "Well, we were having a pizza," and the therapist says, "Yes." He says, "We ate the whole pizza, but there was one slice left," and the therapist says, "Yes." And he said, so I said to my wife, I said, "Do you want that piece of pizza?" And my wife screamed at the top of her lungs, got up and ran out of the room. All I said was, "Do you want that piece of pizza?" And the therapist looks at the wife, and she says, "Is that the way it happened?" The wife says, "Absolutely." So the therapist says, "That's very interesting. What is your understanding of that?" And the wife said, "I don't know. All of a sudden, when he asked me that, I felt like he was telling me I was fat."
Yep.
And I have all this body shame. And she says, "I was fat when I was a little girl, and now she's not. But she says, when he asked me that, I thought he was telling me, oh, go ahead and have it. You probably want it anyway because you're fat." All he really said was, "Do you want that other piece of pizza?"
Right.
Right. And so that's an example that is like, oh, as I'm listening to it, it's like, wow. But that is so common, where things like that happen, and we have no idea. And from his point of view, she's crazy, right? Because the only reason he asked her is because he wanted the piece of pizza. And he wanted to see, he was going to be polite and see if she wanted it first, right? So that, and so her reaction was a reaction. It wasn't a response. Responding would be for him to say, "Do you want that piece of pizza?" And if she felt like he was saying that she was fat, and she really felt that, she would say, "Wait a second, are you telling me that I'm fat?" And then he would say, "What do you mean? I just asked if you want the piece of pizza." And she would say, "Oh, you're not telling me I'm fat." And he would say, "No." And then she would say yes or no. She wanted it or she didn't want it. It wouldn't be that she would just be able to answer it because she did get triggered. So when we get triggered, the trigger is going to happen.
Yes.
The trigger is there.
Right.
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 But how we deal with that trigger, that's up to us. And if we're aware that we've been triggered, then we can handle it one way. And if we're unaware that we've been triggered, then we handle it a totally different way.
Exactly. And that's why we hear a lot in therapy that, the husband will say to the wife that if she wouldn't have done certain thing, he wouldn't have hit her.
Mm-hmm.
If she wouldn't have done something, there wouldn't be any verbal abuse. If he wouldn't have come home late, she wouldn't have done whatever, right?
Right.
So they just look at the behavior of the other person without looking at what's being triggered inside.
Correct.
And essentially, our reaction is directly related to what trigger us inside of us, and it's not really what the other person does. Now, some of the actions obviously are hurtful, or they're not acceptable in a relationship. For example, if one of the partners has an affair, that's given, but we're not talking about that kind of a behavior. And even that, of course, those kind of behavior can also trigger the other person.
Yeah.
In so many ways.
Again, you brought up an affair. So let's say the couple, they're talking, and one of the husband or wife says, "Listen, I have something to tell you. I've been having an affair." Okay. Now, even if there's no trigger inside the partner who's being told, that's not good news.
No, that's
right?
not good news.
That's not good news. You don't want to know usually, unless you have an open marriage. But in general, when we have monogamy, you don't want to know that your partner has been with another person. And then if that person tells you that, you're getting bad news.
Right.
Even with that, you still have a choice of responses, right? You can look at the person, you can get all red in the face, and you can start screaming and yelling at the top of your lungs. You can go into the kitchen and grab a knife and try to stab the person. You can go and try and choke the person.
We don't recommend that, of course.
We're not recommending it, no. You can try and choke the person. You can say, not recommending. You can also say, okay, the relationship's over, and just walk out of the house.
Or ask them to leave.
Or you can say, wow, that's really hurtful. That's really hurtful. And I never suspected that you would do it. And I'm not sure what to say right now. I'm in shock. Now, all of those are possible responses, right?
Yes.
And if we choose our response, then we are saying that we have the ability to respond to the person based on how we choose to respond. We call the ability to respond our response ability.
Right.
Responsibility means that we have the power to choose our responses. That's one meaning of responsibility. So if the person says, "Wow, I'm in shock. I don't even know how to respond right now, and I'm gonna take a break, and I'm gonna come back, and then we're gonna talk about it," that's one way of handling it. Or all the ways I just mentioned, that's another way of handling it, right? So going back to addictions and codependency, and taking responsibility, it is up to us how we choose to behave in any given instance. And how we choose to behave is going to be informed by how aware we are of what's going on inside of us, and what we want to accomplish with our response. If my intention, if I'm in a committed relationship and that person tells me I had an affair, if my intention is to stay curious and to see it as a problem in the relationship, and that I love this person, but this person found it necessary to go outside of the relationship to get those needs met, I may say to myself and to this person, this is a big problem, and I want to work on this. If you do.
Well, that is, of course, that's a perfect scenario we're talking about.
Well, we just
right?
talked about some real imperfect scenarios
yes,
too.
Right. And then, to be that way, to have a perfect response, obviously needs, lots of openness, lots of self-awareness, lots of willingness to make something good happen out of a negative situation.
Right.
Right. And we hope that that's the case, because many times, there are times where the affair is not really an affair. It's just like a, compulsive behavior.
Right. Right.
Right.
Yeah. So when you say an affair is not an affair, you mean there's no emotions involved.
There's no emotions involved.
Right.
Right.
The person just acted out sexually.
Exactly.
Yeah.
Right. And I have had couples like that in my practice. And at first, when I did my own assessment of them, and I realized that there was no emotion attached to the affair, it was unbelievable to both partners. That how can somebody go and have sex multiple times with different people and not have any emotional attachment to it? And that's precisely the case when they go and have multiple, short-time relationship, right? There is no emotional, attachment to it, right? It is done out of the need to release negativity.
The need to release negativity, and there also may be other things going on subconsciously.
Subconsciously, yes.
Right.
Right.
My dad used to always have these affairs, and my mom didn't know about it, but he would confide in me. And now I find myself doing the same thing.
Exactly.
Right.
But having said that, I have to say that if even conditions like this, if they are not, opened up, if they go untreated, they can actually continue.
Oh yeah.
They can continue, and the person may not even become aware of the consequences and how much actually each relationship adds to the discomfort rather than, free the person from the discomfort.
Right.
Right. So when things like that happen, we don't just jump to the conclusion that yes, one of the partners has an affair, and the fact that they come to therapy, that's a good news, because we know that there is an openness to learn about each other and to understand what happened and what caused this situation to happen. So that's a good news.
Right.
And we take that opportunity to assess, to see what caused the person, either could be the wife or the husband or any of the partners, to choose that direction to release their negative, emotions. And once we get to the root cause of it, we normally and usually we see, a good amount of childhood traumas. We see what is known as, insecure and unhealthy, or avoidant form of attachment, right?
Right.
So there are a variety of factors as to why a person chooses to have, a behavior in adulthood that it can come across as compulsivity or addiction. Is primarily due to releasing the negative emotions, and one form of that is codependency.
Correct.
Which is very common, very usual.
Very, very common.
Yeah.
Codependency, I now have come to the conclusion that codependency is the most widespread addiction and the most underdiagnosed.
Right.
And so codependency is what we would call the, I don't want to say it's a disease, but it's been called a disease but I would say it's a condition based on the fact that you have lost your connection to your authentic true
True
self.
self, yes.
What does that mean? That means that you cannot, you have trouble trusting your thoughts and feelings to lead you in the right direction that's right for you. That's basically the essence of it. I can't trust my own thoughts and feelings to lead me in the direction that's in my best interest. So therefore, I'm looking for somebody else to make me feel better because I am living in this fear that I can't trust myself. So I find somebody else that I rely on, and so let's say if I'm in a codependent marriage, I'm the man. I'm looking for my wife to make me feel good. She can make me feel good by smiling at me.
Mhm.
She can make me feel good by doing things for me, cooking me dinner. She can make me feel good by having sex with me. She can make me feel good. And therefore, as long as she's okay, I'm okay. But as soon as she's not okay, as long as she says, "Not tonight, honey, I have a headache,"
Which is the title of our upcoming
which
book.
is the title of our upcoming book, then I'm no longer okay because now I'm rejected. Now I'm being told that I'm not wanted,
And then there is something wrong with me.
and there's something wrong with me, and I don't want to believe that there's anything wrong with me, so I'm going to feel hurt and angry and probably want to punish her.
Right.
Yeah.
Right. So, and then, uh, and codependency is common among couples. Uh, and it doesn't matter really, I mean, they come from all walks of life. And it's something that we learn from our childhood and we grow up with.
Right. So we don't call babies codependents on their mothers.
No, no.
Because babies don't have a sense of self, nor are they expected to have developed a sense of self. So they aren't codependent. What they are is dependent. They're totally dependent when they're tiny. They can't do anything for themselves. And as they get older, 1, 2, 3 years old, they can do a lot more for themselves, but they're still very dependent. They can't do a lot for themselves. Now, what's supposed to happen in childhood is that the parent is supposed to help the child feel good enough about themselves so that they can safely separate themselves from the parent and begin to trust themselves that they can get along without the parent,
Right.
little by little. And so what happens then is we move from dependency into independency. Independency means I don't need you, Mom, now to tie my shoelaces. I don't need you to wipe the snot from my nose when I sneeze. I don't need you to dress me. Um, I can actually do a lot of these things for myself. I can even go to the refrigerator and pour some cereal and eat some cereal for myself. I don't need you, Mom or Dad, to do these things for me. I can do these things for myself. And independency usually lasts throughout teenagehood, uh, and often lasts even into the 20s.
Mhm.
But eventually, if we are able to negotiate the stages of dependency and independency in a way that makes us realize that we can rely on other people and yet we can also take care of ourselves, we move into the third and final stage, which is interdependency.
Right.
Interdependency says, I am independent and I can and do take care of myself, and yet I can be with another person, and if I can't take care of myself because I'm sick, I can allow them to take care of me, and they can take care of themselves. But if they get sick or they have a problem, I can help take care of them, and I don't have and I don't have a problem allowing them to help me.
Right.
Right. But if we have a problem negotiating dependency, meaning that our dependency needs aren't met, then we end up being overly dependent or underly dependent on our partners. And if we're overly dependent, then it puts pressure on a partner to take care of us. And if we're underly dependent, that means that we can't really get close to that partner because we're afraid of being smothered.
Well, I know we do see actually couples that they are overly dependent on each other.
Correct.
And that's where we see the most severe kind of a argument. Because I'm dependent on you to take care of me so I don't feel hurt.
Right.
So as a, you're responsible for my happiness.
And that's what codependency
That's what codependency
is.
is. Exactly.
So my good feelings about who I am stem from being liked by you and receiving approval from you. So if you frown at me, if you are upset with me, then I cannot feel good about myself and I cannot feel happy until you are in a better place with me. And so that puts a lot of pressure on you. And also it doesn't free me because I start to feel resentful when you're in a bad mood. So if you're in a bad mood, I can't be happy because it's a reflection that that you can no longer give to me because you're in a bad mood, and I can feel then resentful toward you because you're in a bad mood. And that's the essence of codependency.
Yes. And that's the essence that brings couples, into many, unneeded, I should say, arguments. So we are hopeful that throughout these programs, those of you who are listening, can gain some insight about what can be the root cause of some of the arguments that you may experience with your partner. And that's why it's important to identify it. So this was our last double show, and we look forward to see you next week at 4 p.m. for episodes of human sexuality and trauma. And it's going to be a brand new program, and we look forward to have you join us. And until then, and we want to thank you for being with us all this time for 2 hours. And we hope that you are there next week as well. And until then, don't forget that all you need is love.
All you need is love. And
love.
have a great weekend.
Bye-bye.
Bye-bye.